Hi, my name is Andrea Clements,
I'm Lily Dover.
and we did a presentation on diabetes type 1 for biochemistry lab. So, what is type 1 diabetes, you may ask? Great question, let me tell you. Type 1 diabetes, also known as insulin dependent diabetes, is a chronic autoimmune condition characterized by the destruction of insulin producing beta cells in the pancreas's islets of Langerhans. This leads to a deficiency of insulin production, and our body needs insulin just to regulate glucose levels. And this is autoimmune response, and it typically has an onset in childhood or adolescence, so a younger age. Although it can develop at any age, but mainly targets the younger crowd. And next, talking about demographics, type 1 diabetes, it constitutes approximately about 5 to 10% of all diagnosed cases of diabetes. And it has an estimated prevalence of 1.6 million individuals in the United States alone, which is crazy. Males have a slightly higher incidence rate, and it could cause the causes could relate to genetic predisposition, so just something that you were born with, that your family has had in the past, just family history, viral infections, dietary triggers, and autoimmune factors. So we'll go a little more into those for the next slide. So first is genetics. And this is, again, having a family history of type 1 diabetes and increases the risk of developing the condition and indicating a genetic predisposition. And next one is viral infections and dietary triggers. These are believed to contribute to development of type 1 diabetes because just because of the triggers that could come in response to those stuff, but it's not exactly like studied out, and not a lot of people know their exact role and significance, but definitely is still being researched, and it could contribute to type 1 diabetes. And the last one is autoimmune factors. This definitely contributes. They're widely recognized as the primary cause of type 1 diabetes, actually. And while the exact triggers and mechanisms underlying the autoimmune response in type 1 diabetes are not fully understood, extensive research has established a strong association between autoimmune factors and the development of the condition.
All right, now for the diagnosis of type 1 diabetes. So there's a bunch of different ways to diagnose diabetes, but these are just a few of the most common tests. And usually a second test needs to be taken in order to actually confirm a diagnosis for diabetes. The first test I'm going to talk about is the A1C test, which is a test that measures the average blood glucose levels over the past 2 to 3 months in a patient. And the nice thing about this test is that you don't have to fast or drink any sugary beverages prior to taking the test. And for this test, diabetes is diagnosed at an A1C that is greater or equal to 6.5%. For the next test, it's the FPG test, which checks for fasting blood glucose levels. This test is usually taken right away at the beginning of the day before breakfast because you're supposed to fast for at least 8 hours prior to taking the test. And diabetes is diagnosed at an FPG that is greater or equal to 126 milligrams per deciliter. And the last test I'm going to talk about is the OGTT test, which is a test that's taken over a 2-hour period, and it checks for blood glucose levels before and after a patient drinks a sugary drink. And for this one, diabetes is diagnosed at a 2-hour blood glucose level that is greater or equal to 200 milligrams per deciliter. Now, for the symptoms of diabetes, the symptoms for this disease is usually very sudden, and it also varies from person to person. But some of the common symptoms include feeling more thirsty than usual, frequent urination, feeling hungry, and unintentional weight loss and irritability. And then this picture over here just shows some of the other common symptoms that some people might experience, like blurry vision, tingling or numb hands and feet, and also wounds that won't heal. All right, now for managing diabetes. This also kind of varies person to person depending on their personal needs and the severity of their situation. But the very first one I'm going to talk about is the blood glucose monitoring, which involves the self-monitoring of blood glucose levels through the use of blood glucose meters or through continuous glucose monitoring systems. And the next one is insulin therapy. This one is super common for people with type 1 diabetes. And this type of treatment uses supplemental insulin to make up for the lack of insulin within the body. This includes daily injections of insulin or also the use of insulin pumps for continuous delivery of insulin when it's needed. Another really important aspect is meal planning and physical activity. So following a balanced meal that includes all the macronutrients, even including carbohydrates, proteins, and fats, helps individuals maintain stable blood glucose levels. Also, regular physical activity helps improve insulin sensitivity and helps individuals manage their weight, which is really important. And as far as hopes for the future, scientists are looking into cell therapy, where they can replace the missing insulin producing cells, which could potentially recover normal insulin production and essentially cure those with type 1 diabetes.
And in conclusion to this, type 1 diabetes is a complex and challenging condition that requires lifelong management to optimize health and well-being. Despite advances in treatment and technology, there's still multiple researchers working on this just to figure out a better way to treat type 1 diabetes. And individuals living with type 1 diabetes face daily challenges in maintaining glycemic control and preventing complications. From the autoimmune destruction of pancreatic beta cells to the constant monitoring of blood glucose levels and the need for insulin therapy, the impact of type 1 diabetes extends beyond physical health, affecting various aspects of life. However, with ongoing research, education, and support, significant progress has been made in understanding the underlying mechanisms of the disease and improving management strategies. And with that, we did a lab last week just studying diabetes more, type 1 and type 2. And we just did a lot of tests with fake urine samples and fake blood samples. And so, yeah, for the last biochemistry lab, the class was instructed to test the amount of glucose in urine and in blood. So for the first lab assignment, we were to test samples of patients' fake blood using a glucose meter to determine the amount of concentration in the blood. So our patient that we had different numbers that we could choose from, and we chose patient number 1, and we just kept it consistent throughout the whole study. And his amount in this glucose meter, after dropping it, was 558, which is determined to have an abnormally high sugar reading. So his sugar level was very high. And for experiments 2 and 3, for 2, our next instruction for the lab was to determine a patient's glucose count in his blood using the OneTouch Ultra glucometer. And patient number 1, again, to keep it consistent, we used 1. He had a reagent color of a pink, dark purplish color, and that concluded that he had a glucose reading of 500. So it kind of just solidified that he had a glucose reading of 500 with this test. And the next test is a glucose determination in the patient's urine using clinistic strips. And the patient number 1 ended up with a reagent color of light green, and that solidified that he had a glucose count of 500. So we were pretty sure at this point that he had the same glucose count and that the tests were very correct. And the last procedure for the lab was to test the patient's urine, patient number 1, using the dipstick test. And patient number 1, he had a pH of 6, and his specific gravity tested 1 out of 5. And he tested negative for ketones and negative for protein. And his urobilinogen was 3.2. And that is all very normal, actually very, very good. The pH was a little low. The standard urine sample is 6.5, but everything else is almost right on the dot. So, but it was included at the end of the lab that patient number 1, he had abnormally high glucose readings. And we at least concluded that he had type 1 diabetes. So, yeah. And we also have a reference page. I don't believe it'll show it, but it'll be on the slides. So thank you so much for listening to our presentation.